Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the December 22nd, 2021 update from the Dubuque County Public Health Incident Management Team. Every time I give an update, I mention the Incident Management Team, or IMT, which is much more than me. Today you are in luck because in a few moments you'll be hearing from all of the Incident Management Team members with a very special message, so stay tuned. In the meantime, let's hit the COVID-19 highlights. As has been the case for what it seems like forever, Dubuque County and most of the state of Iowa continue at high transmission for COVID-19, with 549 cases reported in the last 7 days. That number is down from 733 cases reported on December 8th, but increased significantly since last week's 234 total for the week. That brief decline in cases probably won't happen again for a while, thanks to our new invader, the Omicron variant, which is now exploding in the U.S. and starting to get traction in Iowa. Omicron cases are making up an estimated 73% of the U.S. cases and 5.7% of the cases in Iowa. Today, it's estimated that 1.7% of the new COVID cases are the Omicron variant here in Dubuque County. That low number won't last long. Do you realize that this virus causes new cases at more than 3 times the rate of Delta, with a R0 or reproductive value of 3.47? This means that each person who becomes infected with the COVID Omicron variant will infect at least 3 other people, with the number of cases doubling about every 3 days. The rapid growth rate in Omicron infections is believed to result from a combination of increased transmissibility and the ability to evade immunity from either past infection or vaccination. This is also known as immune evasion, your new COVID term for the day. Data also shows that vaccinated people who either receive a booster dose or who were also previously infected are likely to have stronger protection with Omicron. So what tools do we have to fight Omicron? Same tools we've been using in this order. Vaccination, especially getting your booster dose, wearing masks, and testing if you're symptomatic or exposed. Symptomatic even with basic cold symptoms. And speaking of booster doses, in Dubuque County, of those eligible to receive a booster dose, only 58% have done so. I can't stress enough, if you're 6 months past the second dose of the Pfizer or Moderna vaccine, or 2 months since you've received the single J&J dose, get your booster. The city and county websites have a complete listing of healthcare providers and retail stores that offer COVID-19 vaccinations. And check the site for hours of operation and whether you need an appointment. As we're in the holiday season, be sure to be mindful of your own health and others. Monitor for signs of COVID infection like cough and cold symptoms, headaches, being tired, and not being able to taste or smell. If you have any of these, get tested right away, either through the Test Iowa home mail-in kits, rapid test kits you can buy at drugstores, or through testing at your local healthcare provider. And make sure if you're symptomatic and awaiting test results, don't go out. Stay home. Besides COVID, you don't want to spread any kind of illness crud to others, especially this time of year. It has been another mind-boggling year with a lot of highs and lows and adjustments along the way. Regardless of that, let's take this holiday season to remember those who have died from COVID-19. And although these deaths are happening less frequently, they are all real people and not just a statistic. Let's also recognize and give strength to our healthcare workers who continue their tireless work for our community. So there's one more thing we need to do this year as it winds down, and that is recognize a leading member of the Dubuque County Public Health Incident Management Team who is retiring and saying farewell. Patrice Lambert, Director of the Dubuque County Health Department, is retiring December 31st, 2021. Patrice has served in this role since 2010, and in fact, most of her entire career has been in public health. Patrice recently stated, "I take pride and comfort in the collective efforts of many over the past 20 months that have limited the pandemic's impact in Dubuque County." Patrice, you can take pride for serving in public health for over 36 years. And now, the members of the incident management team would like to wish Patrice well.
Thank you, Patrice, for taking me in as a new staff member during the COVID-19 pandemic and guiding me over the past year and a half. I appreciate getting the opportunity to learn from you, and I look forward to following in your footsteps. I feel very honored. Enjoy your retirement and enjoy the extra time to keep cheering on the Hawks a little more.
Hi Patrice, wishing you all the best that retirement brings for a long and fun-filled and happy retirement. Thank you for all your years of service to the residents of Dubuque County. Enjoy your retirement.
Patrice, I would like to thank you for your leadership and dedication on the incident management team and for what you have done throughout this COVID-19 pandemic. You can be very proud of your accomplishments and what you have done for the community. Thank you, and please enjoy your retirement.
Congratulations on retirement, Patrice. It's well deserved, and I hope you enjoy every minute of it. Thank you so much for everything.
Patrice, I just want to take this opportunity to thank you for all that you've done for the Dubuque community. You have been an amazing advocate for public health. Your legacy will remain in Dubuque, and you will be missed tremendously. Good luck in your next chapter and all the fun adventures you have waiting for you.
What a committed team. And I'd like to say congratulations, Patrice. I've worked with you for over 35 years. Through the current COVID crisis and other crises, the normal daily grind, happy times, and emergencies. You have been such a kind and understanding colleague and a great advocate for all. I wish you all the best in your retirement and know that you have set the stage for all of us to continue our commitment to public health. Congratulations and happy holidays, everyone.